Hey, it's Rodney and Shelly again from utrainu.com.
Hey.
And in this video, now we're going to show you how to use the massage balls on your glutes. Now in the post, we mentioned about the three glute muscles, your gluteus, maximus, medius, and minimus. We could get very specific with how to target each one, but for the most part, I mean, you're going to be just taking the ball and moving around in the area. So what I'll do first off is just get Shelly to come up. So rather than trying to divide it, you can just kneel up and put your backside facing the camera there. So what we're going to do is just trying to work on this whole area right here. Now when you foam roll, which we've shown you in other videos, you're kind of targeting more the whole area. So with the massage ball, it can be a little bit difficult sometimes with a foam roller to get into the back of the pelvis. And our glutes actually run, like if Shelly was to put her hands up on her hips, the way you kind of just rest your hands up on your hips, her glutes actually run right up to this area. So sometimes people can mistake and have low back pain and mistake it for the fact that they might just have a trigger point or some tightness in the top of the glutes, the minimus or the medius, or sometimes even the big one, the maximus. So we're just going to show you how you can kind of work on this area right here and hopefully find some sore spots and get it worked out. So I'll get Shelly just to come on down her side again, the same way we demonstrated how to do your mid-back as well as the QL muscle. And what I'm going to do for this one is get her to place the ball right there. So if you want to just hold on to the ball there. So if you're doing this yourself, this is kind of just a general area as to where you can start. And she can go ahead then and roll over onto her back. Okay, and rest her weight on that ball. Now, just like in the other videos, you're going to just move her body side to side. Just move out of the way here a little bit so you can see better. But she's just going to move side to side, trying to find any kind of sore spots in her glutes. She can move all the way in, and she just found one there based on her face. You okay?
Yeah. Okay.
All right, make sure to breathe through your belly as always, like we talked about with these. You want to make sure your body gets the impression that it's in a relaxed state and we're not tensing up. When you're tensed up, you're going to have a lot of trouble trying to release any kind of soreness or a trigger point in the muscle. But when we are working on this area, again, she's kind of working in this whole region right here. You can go all the way from the back of your pelvis around where your SI joint is, just to the side of it, all the way out, almost out to the lateral part of your hips. So she can move around that area. As soon as she finds a spot, she can stay on it for anywhere between 30 seconds and a minute to see if it starts to let go a little bit. And you'll really know if you're on the glute minimus muscle, because that actually does create referral pain right down your leg.
I have referral pain.
You're having it right now, yeah. So sometimes people can mistakenly think that they have, say, like sciatica, because they're getting this pain down their leg when they're sat down for long periods of time or doing different activities. And what's actually going on is they could have some trigger points in their glutes, and if they work those out, it might help alleviate that pain going down the leg, right? So that's how you do the glutes. And once again, thank you for watching.